Hi, guys, it's Dr. Sadaf, and I just wanted to give you an update as to what is going on. So, I have opened up my practice in Chappaqua, New York, and I'm currently accepting new patients. So, I want to invite you to come and become a patient of mine. If you've been listening to this podcast, you've been listening to the episodes, you are finding so much value in all of this. I want to invite you to become a patient of mine and come see the difference with a doctor that actually has time to listen to you and support you through the transitions that you may be experiencing, whether they're perimenopause, menopause, or you're experiencing any type of sexual dysfunction. And of course, I do annual GYN exams as well. So if you're not having any problems at all and you just need a regular exam done, I am more than happy to help you out. So make sure you check out the practice. It's called FemV Health, and the website for that is www.femvhealth.com. And make sure you look that up. The phone number for the practice is 914-538-2534. And make sure that you go and check it out. Check out the website and make sure you book your appointment today. Also, I have just started a new Facebook group. It's called It Might Be Menopause Support Group by Dr. Sadaf Lodi, FemV Health. And I'd love for you to come and join that Facebook group, because in that group, we'll be talking about different ways that you can get support and education as you go through this important transition in your life. It's also about building a community that is going through the same things that you are. Oftentimes we feel that when we go through things in our life that we are the only one, but I'm here to tell you that you are not alone, and that there are so many other women going through the same symptoms that you may be going through, whether it's hot flashes, night sweats, mood swings, vaginal dryness, pain with sex, brain fog, joint pain, dry eyes, any of those things, so come join us in that Facebook group. It's called It Might Be Menopause Support Group by Dr. Sadaf Lodi, and that's on Facebook. So come and join us in that community. And I definitely look forward to welcoming you there. And make sure that if you have any questions about any of the podcasts that I do, that you either DM me or email me, and I will create a podcast just for you, because you are a loyal listener and subscriber, and I would love to answer any and all of your questions. So if you have any burning questions that you are wondering about, please make sure that you email me at hello@femvhealth.com and let me know about your questions, or DM me on Instagram or TikTok, and I'll create an episode just for you. And as always, make sure you like, share, and subscribe to this podcast. As you know, I am looking to get over 100,000 downloads by the end of this year, and I'd love for you to help me out in that endeavor. And so please share and like these podcasts, download them, and let all your family and friends know, because I know there is not much information out there, and some of the information out there is not actually factual. So you want to make sure that you are getting your medical information from a board certified OBGYN that knows and has studied all of this material, whether it's sexual medicine, perimenopause, or menopause. So looking forward to hearing from you. And now to the episode. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about intimacy and testosterone and menopause and all the great stuff, because I have this amazing guest on today that I will have her introduce herself. And before I get into it, the first thing I want to make very clear is we are not giving any type of medical advice. So if you have any questions about your health, please speak with your healthcare provider. And this is definitely not any advice on religion. So if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is a Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So I am super, super excited to welcome back onto the podcast Dr. Kelly Casperson. Dr. Casperson is super, super vocal with her advocacy and all the great things that she does with intimacy and sexual health and menopause. And is super busy, but took some time out to be on the podcast today. So I am so excited to welcome you on, Dr. Casperson.
Thanks for having me.
Yes.
Thanks
And
for
so
rolling with my crazy schedule.
no problem. So, for those people that may not know you, and I know that's probably rare, but for those that may not know you, if you could introduce yourself to the people listening and viewing this episode.
Yeah. So thanks for having me. I'm Kelly Casperson. I am a urologist. I've been in private practice in Washington State for about 12 years now. 7 years ago, I had a woman crying in my office because of some sexual health issues, and she changed my life. She changed everybody else's life because I started to do the research, questioning why do we get such crappy sex ed? Why are women having such crappy sex lives? Is it true? Is it because we're too difficult? Is it because we're challenging? No, it's because we don't care to teach people. So
Yeah.
I learned a bunch, started a podcast 5 years ago now. It'll be 5 years
Amazing.
and 3 months that the You Are Not Broken podcast has been out. Wrote the You Are Not Broken book, which just got its re-release in September.
Yay, that's
Yay, which is great.
right.
So a bigger audience. Now it's in
Mhm.
Europe and South Africa and Australia
Amazing.
and all the bigger places because I was just kind of thinking I'd help the Americans. And then you realize, no, nobody's got a good sex ed. Everybody's got it bad. We're all working with blinders on.
Yes.
Um, so yeah, it's been a wild trip. I hang out mostly on Instagram.
Yeah.
And, I talk a lot more about hormones and menopause on Instagram just because Instagram still has a big bias against female body parts and intimacy and sex ed. So podcasts are a nice place to talk about that because it's still not a safe space in a lot of social media.
Yeah, absolutely, absolutely. And I know about that shadow banning. I've had that done to me actually on TikTok, so it's it's pretty annoying. So I'd love for you to tell us a little bit about your book for those that have not read it yet, and if you haven't, you definitely need to read it. But tell me, for who is this book ideal for? Who is a person that may be out there? I know it's probably ideal for really everyone,
Yeah.
but who is the person that you had in mind when you were writing that book?
Yeah. So the person I had in mind was mid-career, long-term relationship, heterosexual woman who's like, is this all there is to sex? What's wrong with me? Because sex, they say, is supposed to be amazing, and I could really take it or leave it. Like that was my avatar. And the more that this book gets out in the world, the more I hear from people, the more I'm like, it's going to young females, right? Like late
Mm,
teens, early 20s. Like, let's hit the ground running with some knowledge so we're not
yeah,
recovering the 2 decades of broken sex when we're 45.
yeah.
The other big group that this is really helping is men. So men
Mm,
are like, oh my God, it all makes sense now. I understand
wow,
this so much better. I wish I got this education.
right.
Multiple people saying this saved my marriage, really giving people a way to communicate about difficult conversations and
Yeah,
to realize that this is something that's actually can be improved upon with some education. It's amazing how much education is all people need,
yeah.
right? Like there's still, don't get me wrong, there's a role for sex therapists, there's a role for physicians and pharmacologics and medications and hormones, but most people just need the knowledge.
Yeah.
And then they're like, oh, I thought I was the only one who's never had an orgasm. I thought I was the only one who, didn't have an orgasm by putting a penis in a vagina. Like, no, that's 70% of vagina owners.
Yeah.
Oh, that's good to know, right? So it's like really basic. I call it adult sex ed,
Yeah.
right? You're probably past the I don't want to get pregnant and I don't need to worry about catching diseases, right? Especially if you're in that monogamous relationship. So the things you learned when you were in puberty and probably not even sexually active, those don't serve you anymore. You don't have
Yeah.
those issues anymore. Especially if you're heading into perimenopause, menopause, when you're like, I spent my whole life just trying not to get pregnant. Now that's not a worry. What's the
Yeah.
point of sex?
Right, right. No, that's fantastic. As so many times when I'm in the clinic, I hear women that are in perimenopause and menopause. And when you ask them about their sexual health, they'll say, oh, that part of me, I just don't use it anymore, as if they're like giving up smoking or something like that, right? Like it's just not anything that they even think about. And they're like, oh, I'm done with that. And I'm like, but no, you don't need to be done with it. Is it something that you want? Because if you want, I can help you out. But if you don't want it, that's okay. But, not saying that everyone, wants to continue their sexual life into menopause, but I just don't want people to equate menopause with abstinence, right? It's not something that we need to give up. And there are just different ways that it can get better, and perhaps some medication, perhaps some, lubrication, perhaps there's so many different things that you can do. But I think we have to get to the root cause of it.
Yeah, I mean, I think you bring up so many good points, right? Of like our cultural stereotype and who's allowed to have sex,
Yeah.
right? The cultural stereotype that older people aren't sexual, which is absolutely not true. I saw this couple, they were in their late 40s and they're like, well, I guess we're just too old for this now. And I'm like, I literally just saw like an 82-year-old couple who were having sex 3 times a week. Right. And they were like, really? And I'm like,
Yeah.
oh, you don't know that like old people have sex.
Yeah.
Right. So like just this cultural stereotype of who has
Yeah.
the permission to be
Yeah.
sexual is an interesting
Yes.
talk. But I think also, what you're saying speaks to the fact of women being like, you know what, I'm to the point where like I don't need to really eat mushy broccoli anymore in my life, and I'm fine with that.
Yeah.
And you're like, did you know it could be delicious? Did you
Right.
know it didn't have to be mushy broccoli? Right. And so to me, I'm like, you're gonna give up something that's a challenge, certainly something that's painful, certainly something that isn't bringing you pleasure, certainly something that's a to-do list or a chore,
Yeah.
right?
Yeah.
Those things are very easy to give up.
Yeah.
But if you're like, this is amazing, but it might be starting to change, I want to make sure I can keep it amazing. That's equally as awesome. And you're right. We're not here to tell everybody to go off and have an amazing sex life. But it's yours for the wanting if you want it.
That's right. That's right. And, so many studies have shown that when anything becomes a chore, you're not going to want it, right? Like if it's part of your to-do list, then it's not anything that's exciting. And also, I think a lot of times people, conflate wanting sex, between like spontaneous and responsive desire. And if it's not spontaneous, then, they don't want it or there's something wrong with them. And, when I spoke with Dr. Rosemary Basson, she actually is with the thought that she thinks that, really everything is responsive desire, and that there's no such thing as
That's right.
spontaneous. And
Yeah.
that, when we were younger, we thought about it, right? Like if you were going to go out on a date with somebody, you thought about it. So it's almost like you planned it, you were already primed,
Yeah.
right? So then if there was a sexual stimuli, you were willing to accept that stimuli, as opposed to people that think that, everything just happens spontaneously. And, if it doesn't happen spontaneously, it's not right.
It's the big myth of Hollywood, right? Like
Yeah.
we're just
Yeah.
like humans like to learn from watching other humans. We got no sex ed. We watch Hollywood. Therefore, we think sex works like Hollywood.
Yeah.
Right? And what's Hollywood? It's spontaneous desire left, right, and down the middle, right? And it's like, well, that makes for very good movies,
Yeah.
but that's
Absolutely.
not what a long-term committed relationship when you're 45 and you're busy and you got 3 kids at home and you got a
Yeah.
full-time job. Like you're not sitting around looking at the next hot thing walking down the street and jumping on them. Right? Like it's not your life.
That's
And
right.
I think that's where Esther Perel just hits the nail on the head, because she's like, listen, we like routine. You've picked routine in your life for a
Mhm.
reason. It's
Mhm.
comfortable, it's stable, it's great to build wealth with. Like, we love routine. Routine sucks for an
Yeah.
interesting,
Right.
thriving, spontaneous sex life. You
Right.
must work on that because
Yeah.
you literally can't demand both without prioritizing it.
Right. Absolutely. Absolutely. And so recently I went to Pakistan in February, and then was there for about 2 weeks. And I was talking to somebody, and they were telling me how women there, and just switching the subject a little bit, they don't get much about menopause, and I know that you've done a documentary, and that's releasing on October 17th, if I'm not mistaken,
Mhm.
and that people can host viewing parties, which I'd love to do. But I
You
went
totally
there,
should.
and
You totally should.
Yeah, I will. but so when I went there, I was talking to some women over there, and they were saying how nobody talks about menopause, nobody talks about sex. I was talking to a relative of mine who was saying that so many of his friends have had broken marriages because the women enter menopause, they start to have painful sex, they don't know what that's all about. All of a sudden, before they were fine, but now they're having pain, and so then they start turning away and refusing their husbands, even if they, perhaps liked sex before, and now they're having pain. They don't want it anymore, just like what you said, right? Anything that's painful, you're not going to want. And so this leads to broken marriages, and, perhaps some people having affairs and this and that, and thinking that, oh, my wife is turning me away. She doesn't want me anymore. She's not interested. Whereas that's not really the case. But it's because nobody's talking about menopause. Nobody's talking about pain with sex. Nobody's talking about the changes that happen. And I think you talk a little bit about that in your documentary. So I'd love to know about your documentary and what you focus on in that documentary.
Yeah. Oh, well, thank you for going over there and speaking for those women first and foremost. I remember, I think it was last summer, a summer ago, a woman from Pakistan reached out to me because she's like, how do I get vaginal estrogen?
Yes.
This destroys relationships,
Mhm.
right? And
Mhm.
and I had done a reel on, like, here in America, we're like, I want the best. What's the best? Is it the cream? Is it the pill? Is it the ring? Is it the blah 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 blah? Is it the DHEA? Is it the blah blah blah? And really bringing up, we of course we need more options, and of course we need more cost affordable options, but like the fact that we even have options,
Right.
and there are countries that have zero options, and, like,
Correct.
they're like smuggling in vaginal estrogen, which is insane. um I think that perspective is needed to be like, what can we do to speak for all of the women, right? I have an immense privilege. I have this massive megaphone,
Yeah.
of like, how do we speak for all of the women? Because this doesn't just affect one country. It's literally everybody who gets the privilege of living to a certain age. So I digress. Thank you very much for doing that work. The documentary is, now I haven't seen the full documentary, so I
Oh.
can't, I know, so I can't comment on all of it. But what they asked me to do is speak on basically sex and testosterone
Mm.
and the role of hormones in desire and pain.
Okay.
And so one clip that is up is of me, basically it's me having a male testosterone packet, 1% androgel or something like that. And I'm basically like ripping it and showing how women have to microdose a male product
Yes.
because we don't have an FDA approved product, right?
Correct. Yeah.
And to be like, what other medication are you like, just make this last 10 days?
Yeah.
Right? Like, that's not how we went to medical school. That's not how medicine works. Like,
No, it does.
literally, you can't write, pea-sized amount. The pharmacist will lose their minds. You're not allowed to even write that on a prescription anymore, right? But here we are left with this very unequal gender bias in who's allowed to have their sexual dysfunction treated. Viagra's been out since 1998. It's in generics. It has multiple competitors. We've got 40% of erectile dysfunction by age 40. Okay. Well, for female sexual dysfunction, we have low desire of about 40% by age
Mm.
40.
Yeah.
We have zero hormonal treatment options. We have 2 FDA non-hormonal treatment options that are expensive still,
Wow.
um, and don't work in everybody, just like Viagra doesn't work in everybody. But to have so many papers on testosterone, and to know testosterone is in the brain and that it affects the brain, and then to literally be gaslit to say, like, studies aren't that great, of like,
Yeah.
how many studies we had to get Viagra approved? One study,
One
6
study.
months, 6 months in duration.
Yeah. Wow.
So don't tell me we don't have enough testosterone studies, because we've got decades. In 1942, a paper
Hmm.
was published, and that paper said, at this time, we believe we have enough evidence to say that testosterone can be safely and beneficially used in women.
Nice. That was that long
1940,
ago.
1942.
Crazy.
It's absolute madness.
Yeah.
Absolute madness. But a man, men's can get FDA approved in 6 months safety data.
Yeah.
Testosterone in men approved with 6 months safety data. There's about 10 testosterone products for men, of which 20% of all men will have low testosterone.
Hmm.
100% of women will have low testosterone
Right.
because of menopause. We have
Yep.
0 FDA approved products.
It's crazy, right? And
So I
that's
think,
makes
I mean,
condoms.
yeah,
Yeah.
no, the documentary is going to be, this is my words again, I haven't seen the documentary, but I think it's going to be quite damning to the healthcare culture of
Yeah.
how we have our tolerance for female suffering is profound.
Absolutely. Absolutely. And that, and I think that we do it to ourselves too. I mean, not only, right? So, not only do we not have the amount of research that we need for women's health products, but I mean, honestly, when I go, like, for example, I have somebody in labor, right? And she tells me that she doesn't want to take any medications because she wants to deliver naturally, right? She doesn't want any medications to help with the pain. She just thinks everything is normal, and she just wants to deal with the pain and this and that. And she's telling me all of this. And I tell her, I'm like, do you know you won't get a medal? Like, nobody's giving you a medal to tolerate this pain. And she's having so much pain, right? And I think that women are just so accustomed to pain and just tolerating it for so long. Like, think about it. We start in puberty, we have our menses. That's painful for a lot of women. I remember coming home from school because I was on my period and I was, rolled up in a ball and I just couldn't be in school. So, we start that tolerance early on. And then we tell women, oh, you don't need an epidural for, labor and this and that and to deliver. And then, as women go on, then they tolerate painful sex. They tolerate, this orgasm gap where they're not orgasming. And then they tolerate, perimenopause and menopause. And I feel like it just continues, right? So, to your point, like, women have been just trained and just in this culture, and not just this culture, but I feel like in a lot of cultures, right? Just to accept pain and just be like, well, that's just the way it is. You just deal with it.
Dude, my mom told me not to get an epidural. So like we do it intergenerational as well.
Yeah.
And I'm
Yeah.
like, I'm a physician. We treat femur fractures with pain.
Right.
We treat everything else for pain. Why is this one part, which is incredibly painful, not
Yeah.
treated with pain medications? And
Yeah.
the whole natural thing is like 1 in 8 women die in childbirth naturally,
Yeah.
right? So like let's not forget that natural kills people.
Yeah, right. Absolutely. And, I tell women this all the time. I say, I can understand if you were, I did a medical mission and I went to Pakistan and I helped train lay midwives to deliver babies, on the field and things like that. And I tell them that I'm like, so I can understand if you were being delivered by a lay midwife out in the field and she doesn't have anything. And then you got to just deliver and just deal with the pain. I'm like, but you are in New York, like in a hospital. Why don't you want it? But whatever. It's okay. I mean, I just think that we are just so used to pain that we accept it at every stage of our lives.
Yeah, I mean, it's interesting, especially with sex, because people will be like, I have low desire and I have pain with sex.
Yeah.
And I always like to take problems away from people, right? And I'm like, no, you have one problem. Don't worry, you don't have two, you have one. You have pain with sex. Like you can't desire painful
Right.
things. You
Right.
don't desire hitting your thumb with a hammer,
Yeah.
right? Of like, you don't have two things. Fix the pain. The desire for sex can be naturally, well, oh, it's not painful anymore.
Yeah.
I'm more into this.
Yeah, that's right. That's right. Absolutely. Tell me a little bit more about your advocacy. So you've been doing a lot of advocacy online and social media, specifically around testosterone, and how you talk a lot about how testosterone, right? I think you write in one of your Instagram posts that, stop gendering hormones,
Yeah.
and that, testosterone is also a female hormone. I'm wondering if you could talk a little bit more about that.
I mean, when Google has it wrong, we've got a lot of work to do, right?
Yeah.
So if you Google what is testosterone, it eventually gets by sentence 4, it does get to all bodies have testosterone, but it starts out by saying it's the male sex hormone. And that's, I mean, I give, some laxity where it's due, but like when we investigated testicles in the 1920s to 1940s, we found testosterone. When we investigated ovaries, we found estrogen, but we kept it pretty cut and dry since then, when everybody at this point knows better. And so we need to start saying that, because what I mean by everybody is like the endocrinologists, the sex hormone research, everybody knows. Like we put these 19 carbon structures in a blue box and we called them androgens. And I was talking to a pharmacist about this. I'm like, is there any reason that these are called androgens?
Yeah.
And he's like, no. I'm like, okay, we just decided to put them in a blue box and call these 19 carbon structures androgens. And he's like, yeah, like it's all made up. All bodies have androgens.
Right.
It's just stereotype that there's like a binary there, which is silly. So some of the very exciting advocacy we're doing, and New York needs to get on board because it's really bad in New York, is deregulating testosterone.
Oh,
So,
tell me about it.
dude, testosterone in New York is very restrictive. I was just in Manhattan for my book, some book parties, and I learned like it's worse in New York than it is in the rest of the country. So to catch people up, testosterone is a Scheduled 3 medication by the DEA, which means it's restricted on a level of ketamine, codeine with Tylenol, and
So
some other
ridiculous.
narcotics, right?
Yeah.
The reason for that was the doping scandals in the sport world in the 1980s. We lost to the Olympics, lots of doping. And so our federal legislature said, we need these synthetic, non-biologic steroids need to be banned or put on a restricted list. Testosterone, which is naturally occurring, which nobody's ever died getting physiologic testosterone doses, got thrown on. The DEA at that time didn't want testosterone on there, but it wasn't the DEA's choice. It was Congress's choice. So that was 1991, the Anti-Doping Act. Since then, we have this massive stigma around testosterone that it's somehow safe or dangerous. It is not. You can only get it for 6 months at a time. In multiple states, your name goes on a list of somebody who's receiving scheduled medications. That's a safety issue, privacy issue. In addition, DEA is cracking down on telemedicine end of this year. Likely, unless things change, likely you're not going to be able to prescribe scheduled medications via telemedicine, which has gone up 80% since COVID. Number one user of telemedicine is women. So this is a women's health issue. And in New York, you can only, it's a Scheduled 2 medication. So it's even more tightly regulated than Scheduled 3. And the other thing in New York is that like it's illegal to prescribe it for anything other than a gynecologic purpose. And then it's like, well, is libido gynecologic?
Right.
Probably not. Right? Like New York's got crazy restrictions on testosterone.
Yeah, I'm working with that right now.
Federal.
Yeah, trying to get mine all fixed up. I mean, just on Friday, I had to prescribe, before I was able to it didn't have any issue. I would talk to the pharmacist, whatever, blah, blah. But now he's like, no, it's got to go through X, Y, and Z and blah, blah. Now I'm like trying to figure all this out. But yeah, I mean, even just trying to get some testosterone for women, where we give it for vestibulodynia, right? Where we mix the estrogen and the testosterone to help with the vestibule. It's so unfortunate. I mean, there's so many hoops that you have to go through just to help women. Is just sometimes it can be a little bit frustrating. Absolutely. So
what we're doing, just for any of your listener who's involved with any state legislature who wants to get on board, we're currently putting a bill through in Washington State. Minnesota's working on one. We're going to deregulate it in the states first, kind of take a role of what marijuana did, right? It's hard to move federal law, but if you can move state law and then enough states deregulate, because to me, I'm like, this is a medical access issue in the time of, it's very difficult to access physicians as it is.
Yeah.
And this is, again, destigmatizing a biologic hormone that it should be equal to estrogen. It should be equal to insulin and thyroid.
Yeah.
It should not be a class 2 or 3 scheduled medication.
Absolutely. Absolutely. That's amazing that you're doing that. We should definitely get on board. I mean, there's Dr. Corinne Men is out here. I'm out here. We actually don't live that far from each other. And, we should start to do that here as well, because it's just absolutely ridiculous what we have to go through just to prescribe medications for our patients. So tell me, what's on the horizon for you? What are you looking forward to going on this year? I mean, we have a few more months. So you already did a documentary, you have a podcast, you have a book. I mean, I think, are you running for office soon?
No, that is not on them. I care too much about what people think. And I think with politics, you have to, 50% of people aren't going to like you by default. So that seems like a really rough job to me. I'd rather work on my stand-up comedy career than politics. Um, I'm going to do some great presentations. I'm speaking at the Sydney Opera House in March 2025. So that's
Wow,
huge. I know.
amazing. That is
I'm
amazing.
opening up my own micro practice,
Yeah,
so very
fantastic.
deep dive. I'm sick of the 10-minute doctor patient relationship
Oh,
killed me.
nope, doesn't work.
So I want time. I want time with women to go deep. So the Casperson Clinic is opening up
Nice,
its doors in January in
very
Bellingham,
nice.
Washington. Currently only going to see Washington State, so people have to come see me. One of the big reasons for that is, what's the point of me getting multiple state licenses if I can't get multiple DEAs and prescribe testosterone?
Yeah, yeah. I mean,
So
right?
to me, I'm like, between Seattle and Vancouver, Canada, I've got millions of women to take care of. So I don't think I'm gonna, yeah, like there's no point of me getting more state licenses if I
Right.
can't prescribe testosterone. And that's the other problem is, so we know menopause is so undertreated. We're really relying on these telemedicine platforms because
Yes.
the healthcare system's already full. What are you going to do with 51% of women coming in asking for vaginal estrogen? But with testosterone being so regulated, even if you have multiple state medical licenses, you can't prescribe testosterone because it's very difficult to get multiple state DEA licenses. So I think the lay person doesn't understand the absolute complexity and
Um,
cost
yeah.
in trying to be a physician who prescribes hormones for people.
Yeah. It's so ridiculous. It's so much easier just to prescribe the estrogen and progesterone, right? But then you
It's
just
easier
miss
to give a
out.
woman an antidepressant.
Yeah. Yeah. Yeah.
25% of women, 25% of midlife women are on an antidepressant. And many people think a lot of that is to treat menopause symptoms.
Yeah, I'm sure it is, right? With all the fallout of the WHI and how many generations, I think, was it you or somebody else who was just talking about two generations of women not
Yeah,
being
that's me.
able to, yeah, yeah,
Because
right?
the big question, what we saw at the menopause conference this year was that what right now, this is insurance claims database, so not compounded medications,
Yeah.
but 1.8% of women in America are on hormones. That's down from 3 to 4% 10 years ago. And the
Wow.
question is, why is it worse?
Right.
Right. And my theory of why it's worse is that because after the WHI, you still had doctors who knew that they were safe and that women benefited. And
Yeah.
those doctors have now retired. And
Yeah.
you've got 2 decades of physicians who got zero training.
Yeah, 100%. I mean, I still remember when the WHI came out, actually, I was a second year resident. And it was, literally overnight. Our attendings, nobody was discussing hormones anymore. We had no idea how to treat women. In fact, earlier on in my career, when people would come to me and talk to me about hot flashes and night sweats and stuff like that, we just didn't have the information. I mean, who was teaching us? Nobody was teaching us. And so, all of this stuff we have to learn on our own, kind of like sexual medicine, right? Where did we learn? I mean, you did a TEDx on adult sex ed. I did a TEDx on sex education for physicians. I mean, there really is no formal sexual education that we're getting, that we're teaching our medical students. And the only people that are being taught, even in residency, are urologists, you guys,
Oh, I
right? I
know.
mean, we're not,
It's insane. And we're not being taught about female. Like,
oh, interesting.
I did not come out this trained. This is dollars and time on my own.
Yeah. Yeah.
um, But yeah, I mean, people are like, "Oh, Kelly, you've got such an amazing niche," and I'm like, "How is sex in 51% of the population a niche? Like, I have like literally the largest niche in the entire definition of. By definition, niche means something small,
Small.
right?
Yeah. Right. Right.
Like, sex is not a niche. It's like we're all here. You are, unless you're a test tube baby, you are here because of sex. It is not. That is not a niche.
Yeah. And even test tube baby, right? I mean, I think we're like dating ourselves. I mean, who calls it a test tube baby?
I know me because I was alive with the first. I think it was like 1984.
I don't even remember, but that's it's hilarious. But yeah,
Is
I
that
mean,
is
like
that even politically correct anymore?
I don't know. I don't know if we can call people test tube babies.
Can we call people test tube babies anymore?
I
Oh my
don't
god,
know.
I apologize. IVF.
That's right. That's right. But yeah, I mean, I think that, right, we don't get any education on sex ed, we don't get any education on menopause. So all of the docs that are doing menopause are learning on their own, like you said, taking up, learning on their own, taking their own tests, whatever, getting certified so that they can help women out because we care about women, right? I mean, like you said, we're 51% of the population, and it's all of our responsibility to help women out in this transition, because if we're lucky enough, and I really think it's a privilege, and I think a lot of us feel that way, is that if we're lucky enough to get to this point in our lives, then we should really, advocate and help each other out, but also celebrate. Right? There's no reason
Yeah,
to end up in a nursing home when we know that there are ways that we can avoid it, when there are treatments out there, when there are things that we can do now so that we can prevent that in the future.
100%. Yeah, I mean, I echo your sentiment of like, you guys, this is a freaking privilege. Somebody emailed me, and I love this. It was a man.
Yeah, of
Man
course.
emailed me this week, and he's like, I don't like the way you talk about longevity because you're not factoring in infant mortality. And if you factor in infant mortality, average age in the eons past was like 76. And I'm like, nobody. And I'm like, okay. And I'm like, okay, so you're assuming that in the 1700s, if you made it past age 5, then you weren't going to die of infectious disease and blood trauma? Like, then you were just good to go after you hit age 5? Like, no, that's not how it works. Like, everything you look at, and these are like, if you look at the wealthiest of men in like aristocratic England in the 1600s, they have this data
Yeah,
because we're not keeping track of how long the women lived. We're keeping track of the wealthy men because
of
they owned the
course.
land.
Yep.
And these men also didn't die in childbirth.
That's
Right?
right.
So this is as good as you can get for longevity. Are you
That's right.
ready?
Yeah, tell me.
42.
Wow.
Now
42.
of course there's outliers.
Yeah.
But the point is, never before on a massive scale have we ever
Yeah.
lived 30 to 40 years past the age of our ovaries.
Right.
This has never been done.
Yeah. Yeah.
And first, like some dude to email me and be like, you forgot the infant mortality. I'm like, no, they factored in the infant mortality. It was still water, sanitation,
Yeah.
plumbing,
Yeah.
food sources, infectious diseases, blunt trauma. And
Mm.
we've basically taken care of all of that, pandemic
Right.
excluded. Like
Right.
we've taken care of all the antibiotics on average has increased everybody's life expectancy by 26 years.
Amazing.
That's just antibiotics, let alone clean drinking water.
Right. Right.
Right. So I'm massively passionate about this topic because I'm like, I don't think people are appreciative. I
Yeah.
don't think people understand. 85 is a freaking miracle, and we're just figuring out how to do it well.
Yeah. Yeah. I think, Kelly, also what we have to take into account are wars, right? I mean, we have all these crazy wars going on right now. And, we're so lucky to be here, but all those people and people suffering famine and things like that, I think that, when we could talk about this at another time, but, we know that people that have experienced trauma, right? For example, colonization, slavery, famine, war, all of those things, that their DNA gets changed and that the
Mhm,
telomeres shorten. And then all
mhm,
of a sudden, they're at risk for certain diseases, like, for example, high blood pressure and diabetes. And like people in Southeast Asia, they have a higher risk of heart disease and diabetes because of the famine that they experienced under British colonialism.
mhm.
So we know that, these things are affecting women. And when we talk about menopause, we know through the SWAN study that different ethnicities go through perimenopause for different lengths of time. And some of that is due to the weathering, right? That women
Yep.
have experienced.
Yeah,
So to
well,
your point,
adverse childhood events, though, so ACEs, right?
yeah,
So women who have higher ACE score, and the ACE score calculator doesn't even account for many traumatic childhood events, right? So
right,
it's
right.
only so many, but women with higher ACE scores have more bothersome and symptomatic menopause symptoms.
Yeah. Yeah, absolutely. Absolutely. And so, just learning how to live better as we age, right? Even if we've experienced trauma, even if we've gone through all of those different things that could affect whether or not we go through perimenopause for a long period of time, is really important to find a practitioner that helps you deal with all of that, right? And that can
Yeah.
help address your symptoms. And that's why it's so important to have more and more people doing menopause and perimenopausal medicine, right? So
Yeah.
that we can all age better.
Yeah, I
To
mean, we
what?
need everybody involved. A while ago, somebody on social media is like, she's just a urologist getting into menopause. And I'm like, do you think the 22,000 gynecologists in this country are enough? There's 80 million women age 40 and above in the United
Yeah,
States of America. Do you
yeah,
think 22,000 gynecologists are enough for them? Like, everybody needs to understand
yeah,
menopause, I would say, and sex, right? But
absolutely.
the cardiologists, the dermatologists,
Yeah,
the nephrologists, the orthopedic surgeons, Lord knows. Of course, the urologists, like
yeah,
family practice, internal medicine, psychiatry. This is an every person job because it's 51% of the population. And to say, oh, don't worry, the gynecologists are taking care of it, 22,000. And they also have to take care of the babies and the bleeding, right? Like, it's not fair to
yeah,
anybody. It's not fair to the women. It's not fair to the gynecologists. Like,
yeah.
this is a human experience that's universal, and we all need to get better at it.
Well, the gynecologists aren't even being trained, right? So I
Yeah.
think that all of us, we need to go down to the basics and start teaching our students, right? That's where it starts. Start teaching our students and then our residents. And I think that every residency should have at least 1 month about like menopause, right? Because even if you're never going to do, and this is, so I lecture to medical students and I just started lecturing about menopause and perimenopause and sexual health and all of that. And I told them, I said, even if you never see women in your practice, right? Never see women, you're gonna know somebody that's a woman. You're gonna have perhaps a mom, sister, spouse, partner, whatever. You're gonna know somebody in some space of your life that is going to need help with this. And so really important that you learn at least the very basics, right? So that you can tell them that there are options, there are treatments, and that they don't have to suffer.
Love it.
Yeah. Yeah, absolutely. Well, so Kelly, tell all the viewers and the listeners how they can get in touch with you. And, they're listening to this and they're like, wow, she is amazing. How can they follow you? How can they get in touch with you? And where can they get your book?
Thank you. So the book is You Are Not Broken, Stop Shoulding All Over Your Sex Life. That's on Amazon and Barnes and Noble. My
Mhm.
website is kellycaspersonmd.com. That's where the information on the clinic is. And then the podcast, any major podcast listening at You Are Not Broken. And then I like to hang out on Instagram at Kelly Casperson MD.
And your documentary.
The documentary is called The M Factor, airing on PBS. Check your local, small private places because there's going to be a lot of screenings. Probably
Yeah.
can figure that out on the M Factor Film website if you want to watch it in person. I'm doing a showing in Bellingham, Washington, October 20th on a
Nice.
very big screen at a very beautiful theater. It's called the Mount Baker
Oh,
Theater. Going to do a
amazing.
premiere, and then it's going to be fun because then we're going to talk for like 20 minutes and do a panel on menopause in the workplace.
Amazing.
So it's going to be a cool like movie plus event.
It's amazing.
And for the physicians and for the healthcare people, there's going to be CME for that documentary.
Oh, nice.
Yeah.
Nice.
So
I mean,
very cool.
as if we needed any more reason to watch it, right?
I
But
know,
that,
but
that's
doctor, we get so picky with we've got limited time. So if you can
yeah,
kill two birds with one stone, bonus.
absolutely, absolutely. Well, thank you so much, Dr. Casperson, for coming on and sharing all the great work that you are doing in so many different avenues with your book, your podcast, your documentary. I mean, you are all over the place. I know you were on live in France. They were
I know. How cool is that?
broadcasting you, they were interviewing you. So you are global, all over the place. So thank you for
I
all
know.
that
It's
you
pretty
do and
awesome.
all the
It's small, this
advocacy.
small niche of mine, right?
Yeah, just a small, just a
This
little.
is my small niche.
Yeah, not big.
Thanks
Well,
for
thank
having
you
me.
so much. Yeah, thank you. And well, we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you're having any issues with your sexual health, perimenopause, menopause, please speak to your healthcare provider. And until next time, This is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.